Bismillahirrahmanirrahim. The thought of the day is Wamal Hayatu Dunya illa Mataul Ghurur. And what is the worldly life except the enjoyment of delusion? Assalamu alaikum. My name is Dr. Inshrah. I'm a PGR of Community Medicine and Public Health at King Edward Medical University, Lahore. So, the topic of my presentation is data collection procedures, and I'll be presenting it under kind supervision of Professor Dr. Saira Afzal. Learning outlines will be introduction to data collection, types of data collection, primary and secondary data collection methods, observation methods, data collection techniques, advantages and disadvantages, recent updates, and then MCQs. At the end of this presentation, the participants will be able to understand the significance of data collection in research, differentiate between primary and secondary methods, identify and explain various data collection techniques, including observation methods, and analyze their strengths and limitations. Introduction to data collection. Data collection is the systematic process of gathering and measuring raw information from various sources to obtain accurate and relevant insights. It plays a crucial role in research as it helps answer specific research questions, test hypotheses, and makes informed decisions in various fields. Effective data collection is fundamental to conducting high standard research and making informed decisions. It plays a vital role in various domains, ensuring that conclusions are based on accurate and objective information. It does this by defining the research problem, ensuring accuracy and minimizing bias, supporting evidence-based decision-making, and then saving researchers time and money. Types of data collection. Data collection is broadly categorized into primary and secondary methods depending on the source of information and research objectives. Primary data collection is where data is collected directly from respondents through methods such as surveys, interviews, focus groups, and experiments. Secondary data collection method is where data is obtained from existing sources such as research papers, government reports, hospital records, and statistical databases. It is useful when primary data is unavailable or impractical to collect. Primary data collection methods are classified into two, depending on the nature of the data and research objectives. These include quantitative approach, qualitative approach. Often a combination of both methods, mixed method approach provides a more comprehensive analysis. Qualitative methods focus on the non-numerical data and explore experiences, perceptions, and behaviors in depth. Common methods include document study, interviews, focus group discussions, non-participant observations, and ethnography. Quantitative methods involve numerical data and structured techniques to measure variables statistically. These methods include surveys, questionnaires, experiments, clinical trials, and structured observations. Methods of primary data collection include specific to research objectives, more reliable and accurate, allows for deep insights. Demerits of primary data collections are time-consuming and expensive, requires extensive planning and execution. Secondary data collection. It refers to the collection of information originally gained by other researchers, organizations, or institutions. It is any information that has already been acquired and documented in various another location. Key sources include books, journal articles and newspapers, organizational records and previous research studies, consensus report, annual reports, government reports, international organizations like UNO, IMF, World Bank, WHO. Methods of secondary data collection includes large sample sizes and historical comparisons, leads to locate primary data, and saves time and cost. Its demerits include potential issues with data reliability and biases, may not be specific to current research, not up to date, and poor accessibility. Data collection procedures. Effective data collection follows structured procedures based on the nature of the research. The three main approaches include qualitative methods, quantitative methods, and observation methods. As I have given a brief introduction of qualitative methods and quantitative methods, and we'll be discussing these later, here we'll discuss observation methods. Observation is a key data collection method used to systematically record behaviors, interactions, or events as they occur. It can be structured observation, where there is use of predefined categories and checklists to record specific behaviors, and unstructured observations, where there are open-ended questions allowing for a more flexible and detailed understanding of behaviors. Types of observations include controlled observations, naturalistic observations, participant observations. The choice of observation method depends on research objectives, ethical considerations, and the level of researcher involvement. Controlled observation. It takes place in a structured environment like a laboratory or classroom. Participants are aware of being observed, which may influence their responses. By adjusting factors like lighting, seating, or communication, researchers can analyze cause and effect relationships in a controlled setting. Example is a researcher studying student engagement in a classroom that may vary teaching methods such as traditional lectures versus interactive decisions to observe how students respond to different instructional styles. Naturalistic observation, it is conducted in real-world settings where behaviors are observed without researcher interference. Since participants are not aware they are being observed, their actions remain authentic and unaffected by external influence. Example is a researcher observing patient-doctor interactions in a hospital waiting area to analyze communication patterns, patient concerns, and doctor's responsiveness without altering the setting. Moving forward to the participant observation, it is a research method in which researcher actively immerses themselves in the environment being studied. However, it carries the risk of observer's bias as the researcher's involvement may influence their perceptions and interpretations. Example is a researcher that joins a rural community to study their health behaviors, dietary practices, and healthcare access, gaining an in-depth understanding of their challenges and cultural influences. Types of participation. There are four types of participations: active, passive, overt, and covert. In active observation method, the researcher actively participates in group activities while collecting data. Example is a public health researcher that joins a community vaccination drive, assisting in the process while observing how individuals respond to vaccine awareness campaigns. Passive observation is where the researcher observes without direct involvement, maintaining a detached role. Example is a healthcare researcher that sits in a hospital waiting area, silently observing doctor-patient interactions to assess community patterns and patient satisfaction. Overt observation. The researcher reveals their identity and purpose, ensuring ethical transparency but possibly influencing participants' behavior. Example is a medical educator that observes doctor in a hospital ward to assess their adherence to infection control protocols while staff is aware that they are being monitored. Covert observation is where the researcher does not reveal their identity, allowing for natural behaviors but raising ethical concerns regarding consent and privacy. Example is a public health researcher that discreetly observes hand hygiene practices in a hospital restroom to assess compliance with infection prevention guidelines. Based on these four types of observations, we have four combinations: overt and passive. It is called observer behavior, observe and active, where the observer is called participants, covert and passive, it is called lurker, and covert and active, that is called spy. These are the 5 steps that are involved in participant observations: identify case, gain access, build rapport, observe behaviors, and then record behaviors. Utility of participant observation. Participant observation is useful for understanding how people behave in real-world settings without altering their actions. It helps researchers gather authentic insights, especially in situations where direct questioning might influence responses. This method provides a deeper understanding of social interactions, cultural practices, and group dynamics. It is particularly valuable for exploring new or complex topics where structured methods may not be effective. Advantages of participants' observations. Provides rich, in-depth data through direct involvement, useful for studying natural behaviors in real-world settings, helps build rapport with participants, leading to better data collection, allows researchers to observe predicted outcomes in real time. Disadvantages include can be challenging and require significant time and effort, may lead to observer bias, affecting the objectivity of findings. Ethical concerns arise in covert observations due to lack of consent. Data collection tools. Data collection tools are the devices and instruments used to gather the data. To ensure the quality and credibility of research findings, data collection tools must be reliable, that is, consistent results when repeated, and valid, accurately measuring what they are intended to measure. Data collection techniques refers to the specific approaches used to implement data collection methods effectively. Key considerations include selection depends on research types, qualitative versus quantitative. Proper training ensures consistency and minimizes bias. Ethical concerns like confidentiality and consent must be addressed. Types of techniques include questionnaires, interviews, surveys, focus group discussions, and others. Data collection tools versus technique. In research, data collection involves both tools and techniques, which serves distinct but complementary tools. Tools are the instruments or devices used for data collection. Tools help in recording, measuring, or capturing data systematically. Examples are questions, checklists, forms, scales, guides, pen, and eyes. Techniques refers to the methods or approaches applied to gather data. Techniques determine how data is collected using different tools. Examples are case studies, surveys, experimentation, interviews, and observations. Moving forward to a few techniques. Questionnaire method. A questionnaire is a structured set of pre-designed questions used for systematically collecting data from respondents. It can be self-administered, where participants fill it out independently, or interviewer-administered, where a researcher facilitates the process. Informants must read and comprehend questions before responding in the designated section. Ways of acquiring data by questionnaire methods include computer. Questions are asked online or via software, allowing for quick data collection and analysis. Phone surveys, it occurs over the phone, useful for reaching respondents who may not have internet access. In-house surveys, conducted face-to-face at a specific location, such as homes, offices, or research centers. And then mails, sent via postal mails, allowing respondents to complete them at their convenience, though response rates may be low. These are the different types of questionnaire. Format of questionnaires. Questions may be close-ended. Respondents choose from predefined answer options, making data easy to analyze. Example is, which mode of transportation do you mostly use? A, car, B, bus, C, bicycle, D, walking. Open-ended questions allow respondents to answer in their own words, providing detailed insights. Like, what challenges do you face while using public transportation? Scaling questions. Scaling questions measure attitudes or opinions using numerical or categorical scale. Example is a Likert scale. How satisfied are you with public transportation services? 1, very dissatisfied, 2, dissatisfied, 3, neutral, 4, satisfied, and 5, very satisfied. And then pictorial questions. Use images or samples to help respondents choose their answers, useful for children or individuals with low literacy. This is an example of a pictorial questionnaire. These are the different steps involved in designing a questionnaire. Characteristics of a good questionnaire. A good questionnaire should have clear and concise wording, avoids leading or biased questions, relevant to research objectives, balanced response options, simple and unambiguous, pre-tested for validity and reliability. Advantages of questionnaire methods are cost-effective and time-efficient, can reach a large population, ensures anonymity leading to honest responses, standardized format allows easy data analysis. Disadvantages include limited flexibility for in-depth responses, risk of low response rates, misinterpretation of questions by respondents, no control over who fills out the questionnaire. Interview method. Interviews are data collection methods that involve direct questions of participants to gather detailed and in-depth information. Interviews allow researchers to explore opinions, experiences, and behaviors in a more interactive and personalized manner. Ways of acquiring data include face-to-face interviews conducted in person, allowing for detailed responses and observations of non-verbal cues. Telephone interviews conducted over the phone, providing convenience and accessibility while maintaining direct interaction. Types of interviews are structured, semi-structured, and unstructured. Semi-structured interview. A standardized interview where all respondents are asked the same predefined questions, ensuring consistency and comparability. Example is a nurse conducting a patient intake interview using a checklist to assess symptoms. Example given, do you have a fever? Yes or no. Semi-structured interviews. A flexible interview format that follows a guideline but allows additional probing basis on the responses. Example is a physician assessing a patient's mental health by asking both set questions and follow-ups. Example given, how often do you feel anxious? Depending upon this answer, he'll ask, can you describe situations that trigger it? Unstructured interviews. A conversational approach with open-ended questions, allowing the interviews to freely express their thoughts. Example is a public health researcher discussing lifestyle factors affecting chronic disease with a patient. Can you describe your daily diet and exercise routine? This is a completely open-ended question. Advantages of interview methods include provide detailed responses, allows for clarification and probing, useful for complex cases, builds rapport with the respondents. Disadvantages include time-consuming and expensive, potential interviewer bias, limited generalizability, dependence on respondent honesty. Survey method. A systematic method of gathering information from a predefined group using structured questions to analyze opinions, behaviors, or trends in a population. It can help researchers explain new features or patterns through their subjects. It is the initial step in quickly acquiring knowledge on popular topics. Researchers can use both quantitative and qualitative methodologies in many situations. Ways of acquiring data includes email surveys, phone surveys, and face-to-face surveys. Types of surveys are longitudinal surveys, where data is collected from the same individuals or groups repeatedly over a period to observe changes and trends. They are useful in healthcare for studying disease progression, treatment effects, or behavioral changes. Example is a study following a group of smokers for 10 years to assess how different smoking cessation programs impact their long-term success rate. And then cross-sectional surveys, where data is collected at a single point in time, providing a snapshot of a population's characteristic or health conditions. They are commonly used in public health to assess disease prevalence or healthcare access. Example is a survey conducted in a community to determine the percentage of children who have received the measles vaccine at a given time. Advantages of survey methods include can reach large populations, cost-effective and quick, good for gathering descriptive data. Disadvantages include potential for response bias, may provide a broad overview but lacks fine details. Moving forward to the focus group discussions, FGD. Focus group discussions are a qualitative research methods used to gather in-depth insights on specific topics. They typically involve 6 to 12 participants who share common characteristics related to the study objective. A trained moderator facilitates the discussion using a semi-structured guide to encourage open dialogue. FGDs usually last 60 to 90 minutes and could involve multiple sessions depending on the research needs. This method is widely used in healthcare to explore patient experiences, treatment perceptions, and public health interventions. This is a pictorial representation of FGD. Skills, competencies, and knowledge required for FGDs. Active listening, effective communication, facilitation skills, neutrality, adaptability, conflict resolution, cultural sensitivity, and ethical considerations. Advantages of FGDs include encourages interaction and idea generation, provides qualitative insights, allows exploration of diverse perspectives, other than vocal expressions, gestures, and provocative acts provide valuable data. Disadvantages include groupthink may affect responses, requires skilled moderations, respondents may be reluctant to express sensitive opinions and worries. Other data collection methods include document study. Document study involves analyzing existing records, reports, policies, or other written materials to extract relevant information. It is widely used in healthcare research to review patient records, hospital policies, or public health reports. This method helps in historical analysis, policy evaluations, and identifying trends without direct data collection. Key informants. Key informants are the individuals with specialized knowledge or experience in a specific area to provide valuable insights through interviews or discussions. In healthcare, key informants may include doctors, hospital administration, or public health officials who offer expert opinions on healthcare policies, disease outbreaks, or community health needs. Case studies. Case studies involve an in-depth investigation of a single event, individual, or organization to explore complex issues in real-world settings. In healthcare, case studies may examine real medical conditions, hospital management strategies, or the impact of specific interventions on patient outcomes. Moving forward to the recent updates. Don't assume, ask. A focus group study on end-of-life care planning with people with intellectual disabilities from minoritized ethnic groups. There is a huge gap in the evidence regarding intersectionality of intellectual disability and ethnicity with end-of-life care planning. The study explored the characteristics of effective and preferred end-of-life care planning approaches and resources for people with intellectual disabilities and minoritized ethnic groups. 9 focus groups and 3 semi-structured individual interviews were held with 41 participants from minoritized ethnic groups, 11 family carers, 25 support staff, and 5 people with intellectual disability. Sessions recorded were transcribed verbatim and analyzed using framework analytical approach. Participants thought that end-of-life care planning practices were dependent on the person's culture, ethnicity, religion, and that it was important to follow these at the end of life. They deemed it important to discover and respect and not assume the individual's perspectives, values, needs, wishes through a person-centered approach. Cultural attitudes to talking about death could hinder end-of-life care planning as participants perceived it as a taboo. Staff highlighted the need for cultural and religious awareness, which could involve seeking information and receiving training. Opening the conversation about death and dying was seen as a potential facilitator for exploring end-of-life care planning. Conclusion is the study was committed to addressing issues of equity, diversity, and inclusion. It was deemed important that staff did not assume but discovered and respected the views and preferences. Validation of an Arabic questionnaire to assess pediatric behavioral feeding disorders. Introduction. This study aimed to develop and validate an Arabic questionnaire to assess abnormal feeding behaviors among Arabic-speaking children. Methods. The scale includes 40 items in 4 subdomains: feeding skills, mealtime circumstances, child behavior, and parent behavior. Scoring was based on a 4-point Likert scale, with lower scores indicating greater impairment. Standardized procedures were used to develop and validate the MPEAS, including the items generation phase, pilot study, validation, and reliability testing. Results. MPEAS demonstrated excellent validity, phase, content, discriminant, predictive and convergent, and reliability. Conclusions. MPES is a valid, reliable, and easily applicable tool for assessing behavioral feeding problems in Arabic-speaking children. This sensitive and specific tool has the potential for significantly improve the screening and treatment of behavioral feeding problems among Arabic-speaking children, offering hope for better outcomes. Moving forward to the MCQs. A research team at ABC Hospital is conducting a study on the effectiveness of a new vaccination control policy. To ensure their findings are reliable, they focus on minimizing bias and collecting accurate data. Why is effective data collection crucial in this study? A. It helps define the research problems and ensures conclusions are evidence-based. B. It allows researchers to manipulate data to support their hypothesis. C. It eliminates the need for ethical considerations in research. D. It ensures that only positive outcomes are reported. Or E. It removes the necessity for peer review in research, scientific research.
It allows.
Yes, the correct answer is
Number
alpha.
C.
Alpha. A public health researcher at XYZ Policy Institute is studying community perceptions of a newly introduced vaccination program. To gain a deeper understanding, they decide to conduct focus group discussions and administer structured surveys. What type of data collection approach is the researcher using? A. Only qualitative approach. B. Only quantitative approach. C. Mixed method approach. D. Secondary data collection. Or E. Experimental approach.
C. C.
The correct answer is Charlie, mixed method approach. Some medical students are conducting a study on the prevalence of diabetes in the region. Instead of collecting new data, they analyze hospital records, government health reports, and WHO statistics. What type of data collection method is being used? A. Primary data collection. B. Secondary data collection. C. Experimental research. D. Mixed method approach. Or E. Cross-sectional survey.
Secondary
Secondary
data
data
collection.
collection.
Yes, the correct answer is beta. A researcher wants to study how doctors communicate with patients in the emergency department. To ensure natural behavior, the researcher discreetly observes interactions without informing the doctors or patients. This type of observation method is being used. A. Experimental observation. B. Simulated observation. C. Participant observation. D. Controlled observation. Or E. Naturalistic observation.
E.
Participant observation.
Participant observation. C. E. E.
The correct answer is E. Naturalistic observation, because the participant is not actively involved, he is just observing. Mr. A is studying the eating habits of medical staff in a hospital cafeteria. To avoid influencing their choices, the researcher sits among them without revealing their identity or the purpose of the study. Which type of observation is being conducted? A. Overt participant observation. B. Controlled observation. C. Covert participant observation. D. Experimental observation. D. Non-participant observation.
C.
C. Covert participant.
C.
Yes, the correct answer is Charlie. A research team at ABC University is assessing the effectiveness of a new patient education program on diabetes management. They develop a questionnaire but later realize that the questions do not align well with the key aspects of diabetes education. What issue does this indicate? A. The tool lacks reliability. B. The tool lacks validity. C. The tool is not user-friendly. D. The tool is biased. Or E. The tool is outdated.
E.
E.
B. Validity.
Correct answer is beta. The hospital administration develops a questionnaire to evaluate nurse-patient communication. Before finalizing it, they conduct a small-scale trial to check if the questions provide consistent and accurate responses. Which characteristic of a good questionnaire does this represent? A. Avoids leading questions. B. Uses simple language. C. Contains balanced response options. D. Is pre-tested for reliability and validity. Or E. Ensures anonymity.
D. Delta.
Yes, the correct answer is Delta. A healthcare policy analyst is studying the experiences of frontline workers during a pandemic. They use a prepared list of questions but adjust them depending on each participant's response. What is this approach called? A. Structured interview. B. Semi-structured interview. C. Unstructured interview. D. Cross-sectional survey. Or E. Delphi method.
Alpha. Structured.
Semi-structured.
D.
The correct answer is beta, semi-structured. A mental health researcher wants to investigate how stress level in medical students change throughout their education. They collect survey data from the same group of students each year from first to the final year of medical school. What is this method called? A. Longitudinal survey. B. Cross-sectional survey. C. Retrospective cohort study. D. Qualitative study. Or E. Experimental trial.
Longitudinal survey. Longitudinal.
Yes, the correct answer is alpha longitudinal survey. During a focus group discussion on maternal health services, one participant becomes argumentative, disrupting the session. The facilitator acknowledges the participant's concern while maintaining the control of the discussion and ensuring others can speak. Which skill is the facilitator demonstrating? A. Active listening. B. Ethical consideration. C. Structured questioning. D. Analytical reasoning. Or E. Conflict resolution and moderation.
Conflict
Beta,
resolution.
D.
Conflict resolution.
Yes, the
Analytical
correct answer is Rita, conflict resolution and moderation. This is the key to all MCQs. This is the link of our YouTube channel where these presentations are uploaded. Thank you for your attention.
Thank you.
Thank you, Inshrah.